Hi, Crystal. This is the second part of our assessment, and what I'm going to be doing is I'm going to listen to your lungs, your chest, your heart, your stomach. I'm going to be doing some tapping. I'm going to be doing some listening, some looking, okay? And again, let me know if this any of this is bothering you. So first off, I'm going to look at your, can you lift your head up, please? Go ahead and swallow for me. Okay, what I'm doing is I'm looking at your trachea. I'm making sure that it's lining up. Okay, now I'm going to get you to turn around for me, please. I'm going to look at your back, like the way you're breathing. Can you breathe in and out, please? Okay, and your back is expanding when you're breathing out. So what I'm going to do now is I'm going to listen to your breath sounds. Just breathe regular because I don't want you to pass out. Okay. I'm going to check your CVA tenderness, and it would be about right here. Let me know if you feel any pain in here. Yes or no? Nope. Okay, now I'm going to do some tapping. Okay. Now can you turn around, please? I'm going to try the front. Okay. Now I want you to breathe again like normal. I'm just checking to see how you're breathing in and out. It's symmetrical. Okay, I'm going to listen again. Cold stethoscope. Try not to touch you in spots. Okay, now I'm going to do a little bit of tapping. Okay, one more thing. Turn around. I didn't do the back right. The CVA. You have to hit it like this. Okay, did that hurt? All right, good. Okay. All right. So I checked your trachea. It was right. Okay, now lay down for me. Right now I'm going to look at your stomach. Okay, and breathe regularly, please, in and out. All right. And I'm looking, and it's rising equally on both sides. Okay. And so I'm going to listen. Listening to bowel sounds. I'm sorry, cold stethoscope. Okay. Now I'm going to listen to arterial sounds. Okay. Now I'm going to touch. I'm going to try to be gentle because she's ticklish. So I'm finding the liver, and it feels like a rubbery pencil eraser. It's about right here. Does it tickle? Okay. I'll cover you up. I'm going to come this way. I'm going to check her gallbladder, which should be around right here. Does this tickle? I'm sorry. And one more thing, I need to listen to her heart while she's on her side. I got you. Okay. And while she's laying down. Okay. Now I'm going to check your pulses down here. Okay. I'm just checking them. and they are equal. And she has pulses right here, I'm checking, behind her knees, and they're equal. And then she has two pulses right here, and they're equal. Okay, can you sit up and hang your knees, your legs down? I need to check your reflex. Okay, I'm gonna tap it, and it's supposed to, so let me tap it first. Here we go, tap, boing, tap, boing. Okay, now, I need to check your range of motion. I didn't do that. Lay down for me, please. All right, now lift her leg. This is her right leg. Yeah. Move it in a circle. She has good range of motion down here and up here. And also I'm looking at her skin while I'm doing it and I'm touching it. Her skin is warm, range of motion. Her skin is warm, her hair, she's shaving, so it's not that much hair there. And I can see that it has tissue perfusion. Her skin is good. I can see some of her veins. Okay, now, can you please stand up for me? I'm going to check your, put your feet together. Close your eyes. Very good. Okay, now sit back down. You want to lay down? I'm going to check one more. Okay, that one was your Romberg's. Now I'm going to check the heel to toe. Now remember how I told you, put your, okay, now do the other one. Okay, now I need you to stand up again. I'm sorry, I'm out of order. Lean forward and touch your toes. I'm checking your back. Okay, what I'm doing is checking her scoliosis. Her hips are symmetrical. Her spine is straight down. Okay, thank you. You can have a seat. And when I would chart, the things that I would chart would be that her lungs and her thorax, when I inspected them, they were normal. I saw no abnormalities. She didn't have any tenderness when I used my fingers. The CVA tenderness was negative. Her breath sounds are normal. When I inspected her front, the trachea was placed in the center. When I listened to her heart while she was sitting and while she was laying down and while she was on her side, it sounded normal. When I looked at her abdomen, the contour of her abdomen, her stomach is flat. It was symmetrical. Her umbilicus was normal. I was able to find her pulses and her bowel sounds and her hepatic vein. And when I listened to her, when I touched her abdomen, there was no tenderness. I did the light palpitation, but I didn't do the deep because she's ticklish. And when I checked her lower extremities, both of her legs were normal. The skin on her skin was a normal and even color. Her hair was kind of sparse because she had shaved. Her pulses were present in her femoral, her popliteal, her dorsalis, and her posterior. And her range of motion was good. And she has good muscle strength. She's 12, so I did check her heel to her standing. I'm sorry, her Romberg sign and I think I did the heel to shin incorrectly. I think she's supposed to be standing and doing it, but we're done. And her knee reflexes were normal, although she did do it before I touched her. So, and her scoliosis screen was negative when she bent forward. And that's what I would put.